Thank you so much for coming. I'm so excited to run this course today for you about humanitarian missions, and I am just honored to have a really wonderful panel here, members of the ASCRS International Foundation that's led by David Chang, and for those of you who are at the opening session, I hope you're able to hear some of the work that's being done by the International Foundation. And sitting up here, we have a number of really inspirational physicians who are just passionate about global health and humanitarian missions, and so we put together this panel to basically share our experiences with one another, to share wisdom and insights, hopefully some pearls for those who are interested in participating in global health work, and also to hear from those of you. I know, looking at the audience, many of you have already been out there in the mission field, and we're hoping that we'll be able to share insights and stories with one another. Today on this panel we have a number of great doctors, and just briefly I have to my left here Susan McDonald, who is involved with Moran Eye Outreach. We have Hunter Cherwick, who is the medical director on the Orbis Flying Eye Hospital for many years. I have Dr. Donghae Kim, who is the founder of Vision Care based in Seoul, Korea, and Dr. Stan Pletcher, who is the founder of Global Sight Alliance. My name is Lisa Park. I'm a faculty member at New York University Langone Medical Center. In my day job, I am in faculty practice there, and I also help run the residency program with an emphasis on Bellevue Hospital, which is serving the underserved in New York City. Globally, I'm involved in mission work in Guatemala with the Hospital de la Familia Foundation, as well as Vision Care, which has missions throughout the world, but I'm primarily involved in Ethiopia. So I just want to start off today with just a brief overview of the history of global and humanitarian work in our field. If we talk about global health, we're talking about the health of populations in a global context that transcends the perspectives and concerns of individual nations. And it's been defined as an area of study, research, and practices that places a priority on improving health and achieving equity in health for all people worldwide. And just a brief history of humanitarian efforts around the world. The World Health Organization was founded in 1948 as an offshoot of the UN, but there were no specific activities involved in blindness prevention at its outset. And it was in the 1950s that trachoma was the first blinding disease that attracted the WHO's attention. In the late 1960s to 70s, it became clear that there were other important causes of blindness, and a worldwide campaign was started to combat nutritional blindness as well as river blindness, and that was found in West African countries. In 1978, the International Agency for the Prevention of Blindness, or the IAPB, held its first General Assembly with 44 countries represented. And about 10 years later, they commemorated the 10th anniversary of the WHO Prevention of Blindness program, and that was the first time that major NGOs came together to hold a symposium on blindness due to cataracts. In 1999, the Global Initiative for the Elimination of Avoidable Blindness was formally launched by the WHO in Geneva, Vision 2020, the right to sight. And in 2000, the U.S. Millennium Development Goals were announced as world leaders committed to combat many problems around the world, including poverty, hunger, disease, illiteracy, and environmental degradation and discrimination against women. And included in these goals were certain healthcare initiatives. And these have now transitioned from the Millennium Development Goals into 17 Sustainable Development Goals to be completed by 2030. And we look at the WHO, the goals, the Sustainable Development Goals, we can see here that the primary Millennium Development Goals included the desire to eradicate extreme poverty and hunger around the world, universal primary education, promoting gender equality and empowering women, ensuring environmental sustainability, developing a global partnership for development. But you can see here in these top 8 goals were 3 healthcare goals, which included reducing child mortality, improving maternal health, combating HIV and AIDS, malaria, and other infectious diseases. As these things have been addressed throughout the world, certain other healthcare issues have now come to the forefront. and these include blindness. So the WHO put out a report in 2013, or based on data from 2010, on the prevalence of blindness around the world. As you can see here from this map, that in the developed world, especially in North America, that the prevalence of blindness is less than 0.3%. And you can see from the red marks here where are the areas of blindness most great, and that is in the African countries and in some of the Asian populations, as well as Latin America. Data from the 2013 WHO agenda showed that 285 million people of the 7 billion of the world population are visually impaired, and of those 39 million are blind, and of those 80% are blind from avoidable reasons. 42% refractive error and 33% cataract, a full third from reversible blindness. And you can see here that in these organizations, they're trying to come up with outcome measures. So what are the measures that they're looking at, and measurable indicators that would show an advancement in combating blindness? And one is the number of eye care personnel per million population, and the other is cataract surgical rate. And this is just showing you again, if we look at, from the report of the IAPB, the global causes of blindness, and you can see here that river blindness is 0.7%, trachoma is 3% around the world, cataracts is almost 40%, and uncorrected refractive error is almost 20%. The great majority of these people are over the age of 50. However, we know that blindness impacts all generations, and this is the Jimmy Carter from his center, this statue that depicts the impact. So a blind man who's being led by a child. So the child, because of this adult that's blind, the child is unable to go to school and participate and become an active member of society. So we know that the impact is multi-generational. And therefore, the International Campaign for the Prevention of Blindness worldwide was launched in 1999 with a goal of reducing the causes of avoidable blindness by half by the year 2020. And this was put forth by members of 195 countries and 60 organizations, including the IAPB and the WHO. So for those of us who participate, for the individual physician, we go for the immediate gratification. And so for the patient who is blind and with a simple surgery can then see, and there's usually rejoicing and singing and hugging. And we are so honored as physicians to have this gift, to be able to treat hundreds of people at a time and change them from unproductive members of society to somebody who can see. But we also know for those who participate that this is just a drop in the bucket, and ultimately one needs to educate and to bring the skills that we have to surgeons all over the world. And this is just an example of some of the teaching programs that we are involved in. So today's course is really to pull back for the individuals and some of the logistics and some of the issues that we have faced in preparing for a mission. So we'll be talking about necessary surgical skills, safety considerations, equipment technology, and some issues regarding sustainable supplies.